You're tuned to Radio Kidnappers, the voice of Hawke's Bay. This is the Acupuncture On Air program. Our pleasure, as always, to have in the studio, in the hot seat, Heiko. How you going, Heiko?
I'm very good. I was going to say it's morning, but it's actually afternoon, so I'm a bit thrown out.
That's right. Well, you know, business comes first. That's what I say.
Yeah.
And you're looking very summery there.
Yeah, well, it is. It's Christmas. It's this time of year now. Now I've heard that you've got the super duper, you know, the white album, I call it, from the Beatles, and you've just got it sitting there on your table and you don't even open it.
Well, a special guy gave it to me as a treat, and that special guy, of course, is you, star of stage and screen. And I was just telling you before we came to air that sort of I'm a bit weird when it comes to that sort of stuff. You know, obviously it's going to be quite a rare set.
Yeah.
And it's awesome.
Yeah.
And I think, I'm thinking in two minds that I've told you I've got a Lone Ranger book, which is signed by the Lone Ranger, Clayton Moore, and I haven't actually fully opened the book because I don't want to spoil it, you know. So it's sort of between the devil and the deep blue sea. Do you open it up and not devalue it, but when my kids, you know, when I crack off and my kids say, oh, look, it's got that White Album set.
Yeah. Now those kids, if they get that in 20 years' time, they're just going to sell it on trade.
I might as well open it up.
Open it up, enjoy it.
Yeah, no, you're going to break a tradition this year because it's our last show of the year. What tradition are you breaking?
Well, not breaking any tradition. I've just got probably what you will say is the most weirdest song of the year. So I thought that I'd have that. I'm not going to have any Christmas songs. I'm not going to have Paul McCartney simply having a wonderful Christmas time, and nothing from John Lennon's Christmas album. So,
right. And you are right, that is the weirdest song I've ever heard of, and people will agree with me when we get down there. But anyway, today we're going to talk about sleep apnea. I've heard about it, but what is it? Explain to our listeners what sleep apnea is.
Yeah, well, it's a disease, if that's the right word, that affects people when they sleep, and then it sort of causes them to stop breathing for a few seconds, and then that wakes them up again, and it can affect the full range of people. But if you sort of have a look at the common trend of it, it affects more males than females. And it tends to affect more males. I don't know how they work this out, but between the ages of 55 and 60. So does that mean that they don't need sleep apnea machines after they're 60? I don't know. But it can also affect children. And from the Western science or the doctor's point of view, they say that it can be dangerous because it's depriving the brain of oxygen for that time when you're not breathing. And then they say, well, this can increase the risk of strokes or heart attacks and possibly diabetes and things like that. But
now I have heard of it.
Yeah.
And looking at your notes that you sent through, I'm actually staggered at the amount of people in the US that are suffer from sleep apnea. More than 20 million people. I mean, how common is it right here in New Zealand?
Well, they say it affects about 1% to 2% of people. So, I mean, I guess it's all relative, like how much does it affect someone? I mean, it's a bit like saying, migraines affects so many percent of the population, but some of that percentage is that one person has a migraine once a year and that other person has a migraine 3 times a week, but they all get lumbered into this many percent suffer from migraine. So I think it's the same with sleep apnea, that some people have it more severe than others. And so then, the more severe, then of course the potential from the scientific point of view is that it could be more dangerous or more of a problem.
So what do you put it down to? What causes it?
Well, in terms of Western science, I can't say sort of what causes it. I don't think they actually know what causes it, apart from general sort of aging and and deterioration of the muscles and all sorts of things associated with sleep and snoring, whatever. But Chinese medicine looks at it. It can be a number of causes. One of them can be the liver. And it's interesting from a scientific point of view that they say that sleep apnea can cause fatty liver, or fatty liver causes sleep apnea. Chinese medicine has, for many centuries, always, not totally, but certain problems associated with sleep come from the liver. In fact, the traditional way to sleep, they actually say, is to sleep on the right-hand side of the body with your legs slightly bent, and so this is to encourage the blood to flow to the liver at night, and so that the liver has this regenerating type of effect to help for immunity and things like that. And what's interesting with sleep apnea, it tends to affect more people who sleep on their back. And ironically, if you read through about sleep apnea, they say, oh, you know, one way to fix it is to sleep on your side. Yeah. But you know, that sort of does away with people having to spend $3,000 on a sleep apnea machine to you know, so they can still keep sleeping on their back.
They say it's common in overweight men, aged between 55 and 60.
Yeah, it's only because there's almost a sort of set stereotype there. These particular men they have a very big belly, but not necessarily overweight everywhere else, and often they're even almost skinny in the rest of their physique, or normal, but with a very big, almost like swollen belly. Often quite a sort of reddish face, and these type of guys, they've often had quite an active business sort of work life, stress, a lot of the good things in life, the rich food, the alcohol, yep. Working hard. So it's almost like you can sort of see that particular type of person, almost like
they're a candidate for it.
Yeah, yeah.
Although you did say it can affect children.
That's right, and sleep apnea can affect children, and so again, that makes me wonder. Science has said, if you have sleep apnea, it increases your heart attacks, but then you're not getting heart attacks when you're a kid. Yeah. So this doesn't quite all grind with me.
Acupuncture to the rescue, of course, because there's nothing that acupuncture.
That's right. If there's one thing that you've learned this year, is that acupuncture treats everything.
So what do we do? Do we do the needle?
Definitely, we do the acupuncture, and we mentioned before about the liver. We have certain liver meridian points. A common one that we might do is between the first and the second toe. There are very many others though. But really, we want to focus on actually helping the person to sleep better and to be healthier. So if you think about that stereotype patient that I just mentioned before, you need to address the overweight, and then you need to be addressing why are they craving to have too much alcohol and eating the rich food with the sweet foods. Why are they choosing to be so stressed out and busy? So you need to work on their relaxation and their ability to relax so they can actually sleep better. And then I think coming hand in hand with that will be improved breathing while they're sleeping.
So you're going to put the needle in the liver meridian. What would a Western doctor prescribe perhaps for sleep apnea?
To be honest, I don't think they prescribe any medication at all. I think the foremost treatment is the sleep apnea machines. And there's different ones. Fisher and Paykel, or Fisher and Paykel Healthcare make one. And so you can imagine, with, as you mentioned, 20 million something people in the States, there's a good market for it. Yeah. So, do
you get many people through your clinic suffering from sleep apnea?
I get people suffering from, but not necessarily coming to me for treatment with it. They usually have come for something else, and then during the consultation and the getting the diagnosis and all their signs and symptoms, and they might then mention, I have sleep apnea and I use a sleep apnea machine. And as I said, I've never had anyone that sort of just comes in and has said, I'm on this machine and I want treatment to come off it. It hasn't happened, but I mean, I believe you definitely can, because you can improve people's sleep, their breathing, all that. So it's only natural that you'll be able to improve that function of the stop breathing during the sleep as well.
For the first time this year, I don't see the word moxibustion.
You definitely can. I mean, if the patient is suffering from weakness and deficiency, then we use the moxibustion to improve their, we say their yang energy, to warm them up. Might be points like below the knee or on the abdomen, on their back, on their lower back. So it would definitely be an integral part of that individual person's treatment. Again, with herbs too, I mean, I can't say, take this herb X that treats sleep apnea. It would be, what are you suffering from? Oh, you know, I have trouble to fall asleep, and I have night sweats, and I'm thirsty, and I have this, I have that. So then, you know, you would be making up a formulation to treat that person's constitutional imbalance, or that pattern of disharmony that they have, and with that would come improved sleep and / probably less need for the machine.
Next question, I just about always ask you this one, and how long is a bit of string? So I come along and see I've got sleep apnea, you give me the needle. How long before I'm starting to feel better, and how many times do I have to come and see you?
I'd say, again, from my own personal experience, I can't say, because I actually haven't had a patient that's actually decided to do that. Most patients just decide that they're just going to stay on their sleep apnea machine, and I might be treating them for their tennis elbow, or maybe for their headache or their stomach ache or whatever. So from my own experience, I couldn't really say, but you know, it depends on the constitution and the severity of all the signs and symptoms of the patient. How bad is their ability to fall asleep, and how overweight are they, and do they have any other problems with their bowels, urine? And I couldn't say.
Yeah. You mentioned that. Generally, it happens to guys, say 55 to 60, with the big bellies. Does it happen to people who are in good condition as well?
I'm sure it can, but just my experience with all of the patients that I've had, they've always really just fitted into that model. So it's probably, I'm almost like convinced that that's what they're like,
So really, if we got on a bit of a good diet, although this time of year it's not probably a good idea to consider dieting, is it?
No, well, I mean, I think it's actually banned, the dieting. I think it starts around about the 23rd of December, finishes around 10th of January. Like all forms of dieting is banned.
Yeah, too right there. Okay, look, we're just about out of time, and but before we get to your song, which I've never heard of, thank God I've heard of the group, but I just wanted, on behalf of our listeners here at Radio Kidnappers and the team at Kidnappers, Heiko, I want to thank you for coming in this year.
No, thank you. I mean, this is a great opportunity to help promote acupuncture to the lay public, and it's now, especially with it going on YouTube, it just gives the opportunity for so many people to listen to it.
Okay, let's get to your song. What's it called?
Well, I actually have to look it up what it's called, because I only heard about it the other day. A friend of mine, John Kennedy, the acupuncturist, maybe it's an acupuncture thing. They have weird songs, and he says, "Oh, have you heard? This is one of my favourite songs."
Really?
And he goes, and the song is called "Several species of small furry animals gathered together in a cave and grooving with a pict."
Well, who wouldn't have heard of that song?
Yeah, I mean, just to remember the name of the song.
Pink Floyd.
And look, all I can tell you, it's from the Amagama album, and it's technically a solo Roger Waters song.
I had that album, and
threw it out.
Yeah, I did. The only track I can actually remember off that album is "Careful with That Axe Eugene."
Ah, right.
Have you got that album?
Yeah.
You go home and listen to that.
I've got that song.
Yeah. Have you? Good on you, Heiko. As was our pleasure. You look after yourself.
And we'll see you next year.